Hey everyone, it's Houston from Anderson Longevity Clinic here. Just wanted to do a quick video on how to do a subcutaneous injection. I get a lot of questions about this and figured a video would be the best way to explain it all. So as you can see here, this is kind of what the setup that you're gonna have when you need to do an injection. The cloth is just for any bleeding that might occur. We have a Band-Aid here. We have 2 alcohol prep pads. And then we have also an 18 gauge needle. This needle we wanna use to draw up the medication. Our testosterone is infused with grapeseed oil. So I'll show you how to do it, but what we need to do here is add air to help equalize the pressure within the vial to help the medication come out. And this larger needle is what's really going to help that, that oil get out of the bottle. Then we also have our 1 ml needle, our syringe, and then the 25 gauge needle. And this is the needle that we want to use to inject the medication. And the most common places to inject subcutaneously are the abdomen. That's usually the easiest spot for ease of access. So as you can see here, this needle is very small. It's only ½ an inch long. So as you can imagine, it'd be pretty painless to inject with this. On the other hand, we have the larger 18 gauge needle. I'll just open this one up so that you'll be able to see better. And this one is a lot bigger, so you don't want to inject yourself with this one. This is just for drying up the medication. Okay, so the next thing that we want to do is we're going to switch out our injecting needle with our drying needle. So to do this, we're just going to pull on the gray part of this needle cap here, and I'm just going to pull this off like so. Okay, now we're just going to apply pressure and switch to the larger gauge needle and make sure that's securely on. So now this is ready to drop the medication. Now all we need to do is open up this alcohol pad and we're going to swab the top of the surface and let this dry. That drying process is what kills any bacteria on the surface. All right, now we're going to determine the amount of medication we want to take out from the vial. If we're injecting 0.4 mLs of testosterone, we want to pull up 0.4 mLs of air, and we're going to eventually push this air into the vial, and this is what's used to displace the medication. So I'm going to pull off this plastic cap here. The surface has already been cleansed, and now I'm going to flip this vial upside down, and this is going to make it a lot easier for the medication to come out. So you can see I'm going to push the needle in, and then I'm going to push the air in. This, as you can see, is going to help the medication come out a lot easier. Okay? So we'll get this medication. So I've drawn it out to 0.4. All right, so now we're done with this part. Flip it back upside down so we can take out the needle, and then we're going to safely recap any needles. All right, like so. And then we're going to flip back to the injecting needle and push that one on. Now all that's left to do here is push the rest of the medication through the needle cap. We don't want to leave any air bubbles in the needle. This just prevents any air emboli when we're doing an injection. So just push that through, pushing on the bottom of the plunger there. And now this is ready to inject. So the next steps that we're going to do, I'm just going to walk through it, but we're going to open this alcohol pad, clean off the surface of the skin, and then we're going to pinch this skin, pull off this plastic cap here. Pinching the skin separates the abdominal fat from the muscular layer, and then we're just going to push the medication in. And then we're going to push the needle in, and then we're going to push on the plunger very slowly. We don't want the medication to be pushed too fast because this could apply too much pressure to this needle itself and cause it to come off, losing some of the medication. So we just apply a slow injection, just over 15 seconds. And then once that's done, if there's any blood, we can always apply a Band-Aid. and we can always clean it off with any gauze. So that's it. The best thing to do is to alternate injection sites. So if we're doing the right side one part of the week, we can always switch to the left side. This is going to prevent any scar tissue buildup. But let me know in the comments what you think, and just let me know if you have any additional questions. We can do further videos and follow up to any of the questions. So thank you so much, and I hope you have a great rest of your day.